for you, Dr. Bartow, since that you are you've recovered or you had COVID-19, what are some of the side effects that you're having personally, if you're willing to share that, these many weeks, and how long has it been since you've had those or continue to have those, and what are you doing to treat those?
So yeah, I mean, it's one of those things where it's different for everyone, but for me, I got it toward the middle end of October, ended, my 2-week quarantine just at the beginning of November. And so right now we're, kind of the middle of December. It's been about a month and a half since I've gotten out of that quarantine state, but I still find, like Marie was saying, fatigue is one that catches me off guard. I'll find myself exhausted after lunch in the middle of the day sometimes. And, I'm having to sometimes take naps, little 10-15 minute power naps to keep myself going. Because, for me, having had concussion and I still have some lingering symptoms regarding that, it hits my brain hard. And so I'll have a lot of brain fog. I'll have difficulty remembering certain things. I'll go back later on in the afternoon and find I've made I've placed things in weird places where, normally I have a system for everything, everything's in its place. Headaches are a problem, but the one that really hits the hardest for me on the emotional front is the depression part of it. It's very strange. It's not something that we talk about a lot as a culture. In America, any kind of neurological or mental disorder is typically hidden or frowned upon. It's something that people are afraid to talk about. But having worked a lot with concussion patients, having anxiety, depression, and suicidal ideology, and then seeing it significantly increased after COVID infection, it's something that we definitely need to talk more about. Also, a thing that I've noticed too is that the symptoms will change and fluctuate after a person has tested negative again. My partner, for example, the day we tested negative is the day that she started feeling dizzy. And so she's, had dizzy episodes for about a month. We've gotten that taken care of at this point, as far as we know. We haven't come back yet, but for me, I'll just get hit with depression or brain fog middle of the day, or I'll wake up with it or things like that. So for me, it's a constant effort to retrain the brain and exercise, trying to get everything back to normal.
So back over to you, to James. Who's at greatest risk of the complications from COVID-19?
So when it comes to the risk factors for COVID-19, this is where I say it's time for us to really reevaluate what we're doing, and if we are putting ourselves at risk of this virus or long-term obesity or other complications. This is a time where we can say to ourselves, what are we doing for our bodies? What are we doing to our bodies? Because I think a lot of people, smoking is still very prevalent, and that is a very, very strong risk factor for COVID. Older age, people with immune deficiency, people that are 85 and older, lung disease, racial and ethnic minorities are at higher risk. Who are pregnant or breastfeeding, people who have limited mobility, and that goes back to my notion of exercise being helpful in this situation or other viral situations, because that mobility problem sets us up for blood clots, which has also been found in COVID-19, and pneumonia, which if you're not moving, you're at much higher risk of pneumonia. People that are unable to communicate their symptoms, with developmental disorders or behavioral issues, and people who abuse substances are at the highest or are other risk factors. So, this is when I say it's time to take a look at what we're doing to our bodies. I say, with smoking, when you smoke or you vape, which is probably worse, you're taking in hot air, very high temperature, inhalation. And what that does is cause micro trauma to your lungs and your respiratory system that actually, when you have COVID, the same exact situation occurs. You're having respiratory trauma from the virus. So both together set you up for a whole host of complications. Similarly, when you smoke, you increase the plaque formation in your blood vessels, and you cause trauma to your blood vessels. So when you are, when you're, I lost track of my thoughts. So when you have this damage going on to your body that you're, smoking, or you are, wow, I keep losing track. Anyway, it's a bad thing, and it causes increased risk of heart attack and stroke. So I think now is the time we look at ourselves and say, how can we stop smoking? One big risk factor for a lot of complications anyway. Or, if we're obese or overweight, maybe it's time to look at our nutrition and what we're eating and putting into our bodies. So this is a time where we talk to our primary care provider and work on a wellness plan and try to get back on track. This is a good reminder of how what our bodies are temples, and we need to take care of them. So if we do that and we do the right things, we will be at lower risk of complications in the future, whether it be from COVID or just from our lifestyle choices.
I think, I'm going to answer, or I think you basically answered one of the questions that came in, but it follows with what you just said. It says, it seems like everybody is taking the treating of the symptoms rather than improving wellness as a whole. So from all of you here, I mean, you guys are all working with folks that on many different levels and many different scenarios, but do you think it's something we got to change forward? And how do we do that? How do we change people's mindset of, you've got to be more physically active, or, keeping your bodies healthy? I mean, we're all, we see this now, we're going into holidays, and, that can be the junk food season and lots of eating and snacks and everything. So any response from any of you on the questionnaire? Do you think it's something we can change, and how do we change that mindset moving forward for people improving their wellness as a whole?
Yeah, I think, the biggest thing is having a person in your life, like your primary care provider, should be someone that you are in touch with regularly to discuss your wellness, what you're eating, how you're exercising. And, conventional form of health insurance-based medicine doesn't really offer that, because there's way too many patients per panel on a provider's panel. So I think if we switch to if you're unable to see your provider regularly enough to get yourself in a better exercise and diet plan, then you need to consider switching to someone who is able to focus on those things.
So, Marie and Dr. Bartow, I mean, you see patients on many different levels. You've got potentially concussion patients and folks, and then you have the physical therapy side. Marie, what are things when you have patients come in, are you recommending on this piece about helping them as they're recovering through these different processes, or you're seeing them with those?
It goes back to James. It's a whole life change here. It's the nutrition component. It's having that discussion with your providers and that open conversation with your primary care physicians. Unfortunately, I think we move away from those interactions and those personal experiences that we have with our doctors. We're in and we're out, and those are the conversations that need to start happening again, that we need to take time to listen to our patients, understand what their concerns are, physical therapy wise. When we're working with patients, we get to learn about their life routines, their families, things like that. We get asked oftentimes about nutrition and exercise. And certainly right now, a concern for a lot of people is, how do I exercise? Is it safe going to the gym? Is it, safe coming to the physical therapy clinic? And, there's this, question of, what can I do? And we're lucky, we're in Florida. We're not 16 inches of snow like they have up north right now. We can get outside. And I say that's one of the easiest ways to do it. Walk around your block. You have to start somewhere. Sitting on the couch thinking about it isn't the starting point. If it's walking to the end of the driveway to get your mail a couple times a day to the mailbox, that's a starting point. It goes back to what we say in physical therapy when we're treating orthopedic patients after surgeries. You have to start moving. And that gets back into what James is saying, movement. Not just thinking about get up and move, get the body and the systems going. These COVID patients, James touched on it with blood clots. There's a greater risk of blood clots with COVID-19 patients. And so one of the best ways to avoid blood clots is you get up and moving after surgery. surgeries. It's movement. So it's going out for that walk with your group or independently. And right now, taking advantage of all the things that are available online. We've never had this beautiful, vast array of exercise classes and free sessions to do in the comfort and the safety of your own home. So I always encourage patients here, find something that interests you, go online, see if there's a little class that you can start jumping into. And obviously, if you've got concerns about that, talk back with your primary care providers, go through the screens, make sure it's safe to exercise, all of that kind of thing. But, just picking something you enjoy and just getting into it is really the start of it all.
Amen. I just, to piggyback on two beautiful examples of, movement is life. It's a philosophy that I've carried with me for a very long time. The body in motion heals. The body stagnant will break down. This is a situation where, there are going to be limitations for a lot of people. Did I lose you guys?
Nope, you're good.
Okay, cool. So there are a lot of limitations that people are going to experience, especially if they've had COVID already, and they're having respiratory issues, they're having different limiting things. But being forgiving on yourself is something that I'd like to highlight. Work at the level you can work. Even for someone like myself, who's an avid athlete, I do all kinds of different athletic things. Coming back from 2 weeks of not being able to do anything, still feeling wheezy, still feeling that congestion and constriction of breath, that was rough. Not being able to move the way I used to move was hard. And I was struggling a little bit with, but I used to be able to do this. Why can't I do it now? So it's important to start moving. If you're used to moving and you're having trouble, that's okay. Forgive yourself, keep moving at the level you can. If you don't move normally and this is a new thing, it's gonna hurt a little bit. You're gonna be a little sore, right? You're gonna have a little struggle, but from that struggle comes beautiful things. Another thing is make sure to train your mind. This is something that as a society, we don't do as much. We hear about exercising the body. James and Marie talked about, talk to your primary cares about what do you need to do physically. If you don't have a physician that's willing to talk to you about wellness, find a new physician, find a new provider that's going to be able to spend that time with you and work with you on wellness, but exercise your brain. There's lots of fun brain game apps out there. Obviously Lumosity is a huge one. Peak is a really fun one. Or talk to individuals who do different puzzles and different tasks, because the more you use your brain, the better it's going to function overall. If you're learning new things constantly, the brain actually fires better. And as the front part of the brain fires better, it actually has all these different arms and legs that reach out and touch different parts of your brain to make everything else function better too. So yeah, stay on top of it, keep hope, and it'll be all right. If it's not okay, then it's not the end yet.
There was another question popped in, and this kind of went back to James regarding about, you had talked about reducing the chance of getting COVID, but to take potentially vitamin C, D3, and zinc. There's two pieces here. Is there anything else that can be done? But if those really do help, and then with that, can you get those in a multivitamin, or is that on top of what you need to take if you're taking a multivitamin? Can you take too much of this stuff for any of that? That's just one of the things that's come in here as a question.
Yes, and I want to say anything you put in your body, you have to realize there's a potential complication. When you take a prescription medication every single day, there are long-term consequences, there are short-term consequences, and that's why I focus so much in my practice on wellness and getting people off of their medications, because those side effects, they're not benign typically. Now with vitamins and minerals, you can, like everything else, you can take too much of anything. So sticking to the bottle, sticking to the manufacturer recommendations, speaking with your primary care provider to make sure you're not taking too much. I typically recommend, vitamin D around 10,000 units weekly. Vitamin C varies a little bit, and then zinc as well, just based on the specific vitamin you take. Now, if you're taking a multivitamin, you want to make sure that you're not double taking. Say if there's vitamin C in it, you don't want to take vitamin C on top of your multivitamin because you already have that covered. Things like that, just little things to think about. And then as far as melatonin goes, I typically recommend 10 to 15 milligrams per night to help with sleep. And that, like I said, that also has been linked to increased survival. You know, and all of these things that I'm saying, there's all of the evidence is very new, and the studies are not longitudinal enough. They're not long enough to really make proper statements. But these are just things that I think they're pretty benign as far as if a complication were to occur that we can take and not have, you know, severe complications that from most of them. Yeah. And, you know, warm showers, if you're having respiratory complications, warm showers, laying on your chest, because in the hospital, what they do is we put people on their chest to help with increasing alveolar response so that it helps you breathe a little bit better. Just simple things, you know, try to keep it simple.
So another question that's popped in here is, for those that have been on a ventilator and recovered from the disease, how can they get back to normal activity? Is it possible to take 6 months to a year to fully recover from this, or is it even too new? Are we too far? You know, it's too new to even determine what's going to happen with that. And feel free, any of you can chime in on that.
Yeah, I mean, after you get off of a ventilator, it's definitely a longer recovery process. I think, you know, like I said from the beginning, the treatments that we were offering were worse than the cure, right? We were giving people all these, you know, antibiotics and other medications to help that they thought were helping, but there's complications to everything. And intubation, when we intubate people, it's because they're really not breathing on their own at all. And there are complications from that as well. We see that people stay in the hospital longer when they're intubated. We see that people have worse outcomes when they're intubated. So, you know, hopefully we can avoid that. Now, if you are intubated, there are a lot of complications that can occur down the line. There is ICU, post-ICU. I was reading about it. It's a syndrome where a year after you're admitted to the ICU, you develop psychiatric conditions and you're unable to work because of them. So there are downstream sequelae to being intubated. And I think the biggest thing is making sure you're working with physical therapy very closely, because they're going to help you get up and make sure your muscles are moving again and make sure you're not falling and having other complications. So that's what I thought, I think.
Yeah, and to touch into that as well, obviously, like James said, you know, if you're on a ventilator, it means there's more symptoms that you've had. And there's some studies that are trying to figure out basically if you have a certain amount of symptoms initially, does that indicate how long this recovery period is? You now become one of these long haulers. And of course, you know, ventilator means more bed rest time. You know, like you said, there's complications. You know, we've had, unfortunately, a couple patients who've come through who've been on ventilators and had strokes, you know, things like that. So now we've got that component to it as well. And then, of course, ventilator means hospitalization. Hospitalization oftentimes means isolation. So there's little contact with family. And that touches back into what Dr. Bartow was saying about, you know, this depression and this mental health component to it all, too, because these people haven't had that interaction with their family or their support systems. And they've had these long effects in a hospital and then are oftentimes still not going home. They're now going to an acute rehab center. They're learning how to walk again. You know, long-term bed rest, we know that it produces muscle weakness. And the longer you're on bed rest, the more muscle weakness there is. And so these are factors of physical therapy wise that we keep considering, keep thinking about. And then obviously once people get home and then can come to the outpatient basis, now it's building back up that cardiovascular endurance. People will walk 30 seconds on a treadmill and are just exhausted. And that's okay. That's where we start. You know, we have to start somewhere.
And I don't actually work a lot with ventilators, and I haven't had a lot of patients post-ventilator. But kind of piggybacking with what James and Marie were saying is that, you know, in these situations, there's going to be a long road. And as long as you're doing something to move forward, you're on the right track. There are a lot of people, and we've seen this with concussion in the past and other types of brain injury, where they're like rest, you know, just full rest. That's not how the body works. The body and the brain are designed to recover through use. If you sit and you rest, you waste away, things don't really grow. So there's a period of time that needs a mandatory rest, but most of the time, even while you're in rest, you can be doing small little things to keep yourself active, right? Whether you're, you know, if you're having trouble with motor skills, doing little screws and nuts and bolts and things, or, drawing or doing brain games, or, Zoom chatting with people, communicating and learning new things. And then with physical activity, of course, any movement is good movement. Whatever you're capable of doing, keep it up.
So Marie, back to when we're treating the response, the treatment responses are monitored during physical therapy. So how are these being monitored when people recover from COVID-19?
Yeah, so we've touched base on it a little bit here. Obviously, we're looking at what we call oxygen saturation. Most people have probably seen it, the little thing that you clip on your finger and it reads your oxygen levels. We're looking and monitoring that and making sure that there's not a sudden drop in that. We really shouldn't see the drops in there because the body has a response to when there's a low oxygen number that we increase heart rate. We do these things to naturally bring it back up. And what we're finding is that's one of the things that we really need to monitor. It's the first indication to the body of what kind of stresses the body's under and what kind of responses the body's having. So for us, we're monitoring what we call SpO2. We're monitoring heart rate, respiratory rates, blood pressure. And then we're also monitoring what we call basically like rate of perceived exertions and fatigue and what the person is feeling. How tired do you feel doing this? Do you feel exhausted just walking across the room, or do you feel pretty good with this? And that helps us gauge where we are with them. So taking in the numbers that we can physically see as well as the patient's input into it. We're doing that before exercise, making sure that they're clear for activity. We're doing it during each exercise. We're monitoring almost every minute, depending on the patient, to see what kind of responses and changes they're having. Every activity, every strengthening exercise we do, we're checking it again, because again, we need to see how the body's responding to this. And then obviously seeing at the end of treatment, going through it all again.
So what if you find somebody, or what do you do if you know, or if you know somebody that has tested positive? Any of you can jump in on this, but what do you feel that needs to happen once you realize a coworker or somebody, a loved one, or somebody else that you know have found that tests positive? James, that may be directed to you first, but anybody can chime in.
Yeah, I'd say I always tell people step one is to remain calm. I do COVID testing some weekends, and I have seen people, really have a hard time with this. And, there's a lot of stigma associated with it, obviously, much like there is still with HIV. It's, it's a viral infection. Sometimes you can help getting infected, sometimes you can't. So I say, stress can increase or worsen your immune system. So the best thing you could do is to stay calm, take some deep breaths. And I always recommend meditation videos. They have a host of, like Marie was saying, on YouTube, there's meditation videos, there's exercise videos. There's no reason why you can't do all of these things in your home. And like I said, it's a good time to evaluate your risk factors. Do you drink alcohol because that worsens your immune system? Do you smoke cigarettes or vape because that hurts your immune system and your lungs? Are you getting enough exercise? Do you have a primary care provider? Do they do telehealth appointments? That's something to check out. If your primary care provider does telehealth appointments, like for instance, I have a patient with COVID currently, and I check on him, see how his symptoms are, and make sure that he's just staying on track. And then it's a good time, if someone tests positive, it's a good time to reach out to them and say, hey, how are you doing? Because like they said, it's a very isolating feeling. I tested positive back in March, and I can tell you the whole quarantine process, mental health is on the rise, and I'm a little concerned for our future. So, I would like to say to people, reach out, make sure you're checking on your loved ones, the elderly. There's a lot of depression and anxiety coming out of this. And if you're experiencing suicidal thoughts, contact the suicide helpline or your primary care provider, because there's no need to do this on your own.
Yeah, I'm going to take a little different tack too. I mean, if you find out somebody that has tested positive, first, of course, I love that, James. Stay calm, right? Like, this is not the end of the world. The vast majority of patients are not dying from this. It's it's uncomfortable, it's inconvenient, there's stigma, there's problems with it, but it's another virus, right? Like, we're learning about it. It's a new approach. There's a lot of new things that are happening, but at the end of the day, like, it's going to be okay. But first, have you been in contact with that person? Do you need to go get tested yourself? Contact tracing is important, right? If you're looking at trying to make sure that we keep our sensitive population safe, we need to contact trace. We need to test. So if you need to go get tested, go do it. If you have to take a day or two off of work or away from what you're doing to, wait for those test results, then do it. Be responsible. No day of work, no project, nothing else is worth risking your safety or somebody else's safety, because you never know if you pass it on to somebody else, who it's going to go to. Another thing is, think about it a little differently, like with what James was talking about regarding stigma. This is not a situation where somebody's maliciously going around passing COVID or, to other people. This is not, something that people are doing wrong. Most people that get it from somebody who's asymptomatic, who has no idea that they've even had it. When I tested positive, I went to get checked, not because somebody else around me had it, but because I started feeling really achy. I started feeling really fatigued. And when I went back through 2 weeks of my life, because that incubation period of, 2 to 14 days, I went back through 2 weeks and started talking to everybody that I had been in contact with. Nobody else popped up. Nobody, had any symptoms. Nobody tested positive. And so, I had to start that chain myself of going through, okay, everybody else who I infected, which I unfortunately did get a couple people, I had to go to them and be like, hey, listen, get checked, get away from anybody who's sensitive. But be aware, know what's going on with your health, and of course, stay active, get yourself prepared. James has some amazing points today. Make sure you've got a team in place. Make sure you've got a primary care, whether it's, a doctor, a nurse practitioner, or a chiropractor, somebody who knows what's going on with you and who can help you get where you need to go. But at the end of the day, it'll be okay.
I moving forward, we just, to go in a general question here, but what types of testing are available? And I think I just heard this morning that they're about to approve a home-based test that you can take and buy over the counter for about $30. I haven't gotten all the details on that, but what are some of the testing pieces that are available? What was it that you ended up doing? Did you when you got yours done?
Yeah. So for me, obviously, running a practice where I'm working with patients and the neurological realm, I have some sensitive patients, so I have to be very careful. I immediately contacted a friend of mine who runs a drug testing facility here in Orlando, our company that does office drug testing and stuff. He's done COVID testing as well since the pandemic broke out. So I contacted him and I'm like, hey, I need a rapid test. I need to know in 15 minutes whether or not I've got this, because I've got to start calling patients. And so I did the PCR test. And I had been tested multiple times before this, just because potential exposures and needing to be careful. And every time it showed up negative, but that one time it popped positive. So if you think you have it or may have been exposed and you want to check now, remember there's that window of incubation time. It could take between 2 and 14 days for it to show up in your system. And so they'll scratch the underside of your brain with a Q-tip, and they'll come back with a result relatively quickly. There are places that do it for free. There are places that do it, if you don't have insurance, for a minimal amount. And so it's definitely worth getting it done. Look around your community and find places. But if you think you've had it in the past, like a couple of my patients have come in and they're like, hey, we think we may have had it back in March, but we don't know for sure. Well, you can go get an antibody test. Once your immune system, your body's defense system, has seen an invader, it keeps a record of it, and it'll watch out for that invader again. So you can look to see, does your body have that memory? It's a blood test, and it's pretty good. So I definitely recommend, if you think you've had it in the past and you're having symptoms, you could do the blood test, but the PCR is the current one. And I did hear about the home test that they're talking about. I heard rumors about that. Kind of exciting. It's not the most sensitive test, meaning it doesn't, necessarily pick up everything, but it's a great litmus, especially if you're like, hey, I've tested positive, now I'm checking to see when am I negative again so I can get back to life.
Yeah, Dorothy just sent me. Go ahead, James. I'm sorry.
Oh, no. I just wanted to mention about the testing because, like I said, I do that on the side, and I want to break up a lot of misconceptions about the testing. If you go and get tested and it's negative, doesn't mean really much of anything, because if your viral load is, if you get a nasal swab and your viral load is not high enough in your nose at the time of testing, or if the test is not done properly, which I hope it's done properly, you can test negative and still have the virus. And then in 3 to 4 days, I'm finding that people are coming back in 3 to 4 days because, my symptoms are more severe, and then they're testing positive. So just some, the tests aren't perfect, and they have to be done at a certain time frame, typically within 3 to 7 days of symptoms or exposure, I should say. And, as far as the different types, there's antigen testing, which is the one that is about 15 minutes, and there's the PCR, which is a little bit more sensitive, but that's pretty much reserved for hospitalized patients and special cases like the healthcare workers. But then there's, like you said, there's serology testing, which is antibody testing, and that will only show up positive about a week or so after your infection. Your IgM will test positive, and then your IgG takes a little bit longer, about 3 weeks or so. So just, the tests aren't perfect, and just because you test negative doesn't mean necessarily that you don't have it. So if you're going to go visit family for Christmas, think about your grandmother, and if you're someone that goes out and doesn't take the proper precautions, I would probably advise you not to go visit your grandparents or elderly at this time, and wait till next Christmas. Sorry.
It was mentioned, somebody said, I think I may have had it back in March. And, I know there's antibody testing. How long do antibodies stay in your system or would show up if you've had it? Like, Dr. Bartow, you've had it. How long would antibodies show in your system that that you've had this? Or if somebody back in March may have thought they had it, or was it the flu, or was it something else? Can any of you all speak on that?
Yeah, I had it in March, and I still have the antibodies. So as far as how long they're going to stay in your system, it's still unclear. But I can tell you that I still have antibodies, and my infection was in March.
Gotcha. There's different antibody expressions as well. So we have certain ones that look for a recent infection, and then there are ones that have lifetime memory. And so a lot of the antibody tests are looking for those more recent infections. I don't know, James, you might be able to, or Marie, you might have some more insight on this, but I'm not sure if we have any long-term memory cell tests for anything like this. No, okay.
Yeah, no, they're working on long-term, but they have the IgM currently.
So we've hit a bunch of different pieces on that. But kind of aside, we've talked a little bit about respiratory issues. What other pieces? I know, Dr. Bartow, you spoke about you've had fatigue and pieces, but what are maybe some of the brain symptoms? Are there more than what you've stated, or anything else that you're finding pieces from there, or how can we help them who are suffering with those? What are some of the treatments that we can do? And any of y'all can chime in on that.
Sure, I'll go ahead and spearhead this one. With any of the symptoms regarding COVID-19, it's kind of parallels concussion in the sense that everybody is different, right? This is something that we've been seeing from the beginning with COVID-19. Somebody might have a loss of taste and smell. Somebody might have congestion. Somebody might have both. Somebody may end up not being able to breathe, and they're intubated. So it's a wide variety of different things. And again, like with concussion, some of these seem kind of innocuous, especially if they're by themselves. For instance, headaches, right? Lots of people get headaches, and lots of people get different types of headaches. So how do I know if this is COVID related? How do I know if, this memory trouble that I'm having right now isn't just because I'm a little tired, I'm a little stressed out versus COVID related? How do I know if, the sensitivity to light isn't because, I had a couple drinks last night versus, man, all day long, I'm having the sensitivity to light. And the realistic nature is we just need to start paying attention to what's happening. Small changes happen in our bodies, especially in a situation where you go from feeling normal to having an infection, right? We're knocked down, we're feeling kind of icky, and, we work our way back up, but now we're still having some lingering things, right? And so I mentioned things like brain fog, that's a big one. Memory issues, word recall, not being able to find your words when you're trying to get them out. Depression, anxiety, things that are coming up a little bit more on the emotional front. Maybe you're more irritable. Be aware if there are changes that are different from your normal experience of reality. It's an important time to talk to your primary care, especially somebody, if it's a neurological thing, and say you've got headaches now, or you've got, fogginess and you're not able to function at work, emotional disturbances. Talk to somebody who does neuro work, or a primary care that can push you in the direction of somebody who does that. Because it does get a little more complicated. The work that we do as far as rehabilitating these things works with neuroplasticity. And so this is a really fantastic ability of the brain. Neuro means brain, and plastic can be reformed, remolded, reshaped. So we basically rewire the brain. We strengthen systems as we use them, kind of like muscles, right? They get stronger when you exercise. And so we find the areas that have been impacted by the infection or whatever the injury is, and we slowly, little by little, start exercising them back to health. And it's been working pretty good so far with the patients we've had. So we're hopeful that it's going to continue to work that way for other patients that have survived the COVID-19 infection.
And Marie, how does physical therapy help in the recovery of COVID-19?
I think kind of going off of what Dr. Bartow says here and going back to something he touched base on some of the dizziness aspect of it as well. This is one of those side effects and symptoms that we're seeing long term, and physical therapy wise, we recommend seeing that vestibular specialist. There's people who are trained in this, who can work with you to help with balance, vestibular issues, the dizziness issues. So that's another component in addition to the cardiovascular aspect of it. The cardiovascular aspect of it has quite a bit of studies behind it now that are showing these effects and these long-term ones. Whether you had symptoms or not, we're seeing it, and we're seeing it in some reports with athletes at the moment who've tested positive for COVID, and then they went back out on the court and all of a sudden are having cardiac issues. So it tells us we need to look at the cardiovascular system here and continue to monitor that. But like Dr. Bartow says, focus, whatever symptoms you're having, see a healthcare provider on it, talk to them about it, and let's get people set up with the right person for it. There's people who specialize in these areas. Find those people. Like I said, we've got one in our clinic. He's wonderful with vestibular patients, and I have all my vestibulars see him because that's his specialty. He knows what he's doing here. He knows what's going on. And the same reason why we refer back and forth, why we would refer to Dr. Bartow or to James, based on skill set. So listen to the patient and their symptoms, understand what they're having issues with, and focus on that part. Not every patient's the same. We've said it multiple times over. Everybody has different symptoms. And the important thing is to know that these symptoms in some people are long lasting, and that's what we have to focus on.
And segueing off of Marie's statement, I just would say that just because you're having symptoms that align closely with COVID, it could be that you're going through something entirely medical that can be treated. And if you're having abdominal pain, if you're having chest pain, it could be something else that's life-threatening that can be treated. So that is why it's very important to have a pretty close relationship with your primary care provider and or seek treatment immediately if you're experiencing those things. Because not necessarily always COVID.
This is we touched upon it. With asymptomatic folks that maybe have had it or didn't know they have it or not showing any symptoms. Have any of you potentially treated any of these type of patients, or is there a recommendation to somebody that you had a tickle or had a cough, but it's nothing that's major, or maybe you had, you've had your flu shot, you've had everything, you feel pretty good, you haven't had major symptoms, no fevers, no aches, I think that's a big unknown on one of my questions here, but have you been able to treat anybody there, or have they had any lingering effects that you know of, or do they just not know it and move on with their life and wouldn't know it unless they had an antibody test?
PT-wise, that's what we're seeing. People just didn't know they had it. Obviously, we're screening in our clinics. We're asking these questions. Have you had COVID? Have you had exposure? Have you been around people? And then what we're seeing is we'll check vital signs on those, knowing that there's this cardiovascular component to it. And suddenly patients find, oh shoot, I didn't know that, or oh my gosh, my oxygen levels aren't where they're supposed to be. What do you mean they're not where they're supposed to be? They just had no idea. Because unfortunately, with a little bit of this too, and certainly with the PT, if patients are coming in for something else unrelated to COVID, have a history of a positive COVID test, they're attributing what they're experiencing maybe to what they're coming to see us for, maybe to their surgery. They've been a little bit more inactive because they had surgery, and it could be just a long-term effect of COVID. So we're kind of monitoring that with the asymptomatics just to see, are there some cardiovascular issues or concerns that they don't know about, and trying to catch those early so that then we can refer to the appropriate providers. We can then do further testing to check whether that's cardiologist, primary care, those kind of things.
Do you send them out then to get an antibody or a COVID test at that point?
I usually tell patients touch base with their primary care physicians at this point for the best recommendation. Obviously, if they're coming to the clinic, they're screened and have had testing where they're now no longer with an active virus. They're appropriate to come into the clinic. If for some reason the patient comes in with any kind of symptoms that we suspect that maybe they have COVID-19 and have no idea, we're obviously referring them out immediately and telling them to go get testing, because the testing sites are available. So we'll let patients know we have some concern of this, have you been exposed? Go through the screening with them and say, I think maybe you should just go get a test just to check and be sure and be safe.
Do any of you know, this popped up, but are any of you aware, and I don't know personally, but has it been determined that if you've had COVID, can you get it again?
There are no confirmed actual hard evidence that there's reinfection at this point. I believe they had, the patients that allegedly got reinfected, they didn't have adequate testing performed initially or at the time. So at this time, it's too soon to tell. I'm certain if we go off of the other SARS strains, that there is co-infection, or there is a repeat infection, but it occurs typically a year or so later. But I'm sure, as the time goes on and we learn more, we'll see more. But as of now, there hasn't been any objective documented cases, and at least, yeah.
It's going to be interesting to watch, because with viruses, they have a tendency, they have a predisposition to actually mutate over time. And we see this every year with the flu shots, right? We all know that, like, hey, this flu shot is good for like this group of these potential flu viruses. So like James was saying, we haven't seen anything solid yet saying, okay, it's mutated to the point that now it's causing these reinfections. But that's going to be something interesting to watch in 2021, because that year cycle is where we're probably going to start seeing it, if it's going to be happening. It'd be interesting to see.
Here's a personal question for those that have had COVID. With the flu season here, certain signs and symptoms, did you notice a difference in the symptoms between what you get from the flu? A lot of people have gotten their flu shots because of recommendations now, but between a regular cold or a flu, did you feel anything different during your when you went through COVID?
Yes, I would say that in the case of COVID, if it's very odd symptoms, right? You lose your taste, you lose your sense of smell. In my case, it was body aches from head to toe, and it wasn't like flu body aches. It was more just like a pain in every single joint. And it was a little bit more severe than I would experience with the flu. I don't know if you've experienced the same, Dr. Bartow.
Oh yeah, the first symptom I had is it felt like I got hit by a school bus and then backed over. It was a lot of pain. And so that was the first thing. I was really fatigued and I had a lot of pain. I was like, this is not normal. Like, I don't normally get the flu anyways, but when I have had colds, a little bit of body aches, you feel that like, oh, I'm kind of achy, I'm kind of weak feeling. This was just exponential. It was way, way worse. So that was my first indication. Took a day off, went and got tested, and that was the thing. But as far as the symptoms being completely different as well, when I was sitting at home in quarantine, the body aches took a couple of days and went away. I had a fever for maybe 3 hours, 4 hours. It was really short, but the breathing issues, I've never had a flu or an infection where I was sitting there just kind of like feeling constricted, feeling wheezy, feeling disconnected from reality. I was all foggy and I couldn't really connect on stuff. I must have slept for 20 hours one day because I just couldn't do reality. So definitely different than a normal flu.
So there's that balance where you can feel you're feeling something totally different from what you've experienced in the past.
Some people, yeah, because we have to remember that,
Yeah, it's
like,
all
there's some people that are going to have little to no symptoms. So,
Yeah. Well, great. I've got another question, I think, coming in here. So give me just a moment on that one because we've hit all of ours. And we're kind of do a wrap up here. So bear with me for just a moment and go from there. But yeah, I think that's what worries me when you said that you had a fever for all of 3 or 4 hours, and you had the other symptoms, which is, I think what you have to think about, it's not just a fever, and it's not like I had the fever for the whole 2 weeks that you may have been dealing with the virus. It was, for Dr. Bartow, you said it was short and sweet. And I don't know about you, James. Did you have a fever throughout or various times or?
0 fever, just body aches.
Just bad body aches. And then temperature checks. You get screened at a number of different events or places that you go. How is this supposed to help when you're diagnosed? Like I said, if you're at that, you had a fever for all of 3 hours, and James, you didn't even have a fever. So if you went out, but I guess if you were really feeling as bad as you were, you didn't want to be out with the body aches, because I know how body aches can feel. So do they work? I mean, is it worth being temperature screened? I mean, I guess it would catch it if somebody was fighting the infection onset.
Yeah, we've been looking for solutions from the beginning. And I think, we get into these tasks where it's just giving us a false sense of security. And, the temperature checks is one of them, because I always wonder to myself, oh, well, what is the temperature that you're looking for? And they're doing, are they doing were they trained to use the thermometer? It sounds ridiculous, but each thermometer has to be used appropriately, first of all. So are all these people that are using the thermometers trained appropriately? And, did someone maybe take Tylenol prior to going in? There's so many different variables. I just think it gives us a false sense of security. And if you're concerned, you should stay home. If you're at risk, you should probably stay home, order in, and wait it out. And wash your hands.
And wash your hands. Yes, I think we've all learned, at least I've seen more people washing hands. Not that I've seen them washing them for 20 seconds or not, but at least I think we've gotten a little cleaner, hopefully, as a society. But I do want to say thank you. We are at our time limit here, and I want to say thank you again, James. James is a nurse practitioner and the founder of the Health Carpenter Direct Primary and Preventative Care in Orlando. Also, Marie with Select Marie Stam, got my notes crisscrossed here. Marie Staley with Select Physical Therapy, and the Dr. Colin Bartow with Functional Neurological. I always say this wrong. I don't have it typed in front of me, and I'm kicking myself here. I didn't have it typed out. And functional neurology, chiropractic. Did I get it right?
Yes.
Huh? Yes, well, close enough. There we go. One of these days I will hit that right.
Long to get you.
You can get in touch with any of these folks here through the chamber if you got questions. We'd like to put you there if you want to talk to them further. You can contact us here. We'll be glad to put their information to have out there for you. But all of these folks, thank you so much for your time. I know you got busy days coming up, and I hope you have a great holiday. For those that are well, stay well. I hope those that are recovering on anything can get through these symptoms. And keep us posted. I think it'll be an interesting part down the road to know, how long the effects, and hopefully they're not long-term, meaning years and years and years, that they will dissipate within 6 months to a year. And I wish you all the well. But thank you all. The best. thank you all for being here. Some great information, and we appreciate what you bring to the table. So without further ado, have a great rest of your day.
Thank you.
Have a good one. Thank you so much. Enjoy your day.
Take care, everybody.